Ladies and gentlemen, today we're going to talk about hand, foot, and mouth disease for health section. Hand, foot, and mouth disease is a highly contagious infection. It's caused by viruses from the enterovirus family, most commonly the Coxsackie virus. These viruses can spread from person to person and through different kind of contacts, but especially through direct contact with unwashed hands or surfaces contaminated with feces. It can also be transmitted through contact with an infected person's saliva or stool or respiratory secretions. The pathology is characterized by blisters or sores in the mouth and a rash on hands and feet. The infection can affect people of all ages, but it usually occurs in children under the age of 5 years old. Generally, a mild condition that goes away on its own, so do not worry to find an immediate remedy as soon as you see this happening. Hand, foot, and mouth disease can be transmitted through direct contact because it's a quite contagious virus. Symptoms begin to develop 3 to 7 days after the initial infection, and the period is known as incubation phase or incubation period. The symptoms can appear as fever, poor appetite, sore throat, headache, irritability, painful red blisters in the mouth, red rashes on hands and the soles of the feet. Now, fever and sore throat are usually the first symptoms that we can see. The characteristic blisters and rashes show up later, usually 1 to 2 days after the fever begins. Now, what causes hand, foot, and mouth disease? Well, often they are caused by a strain of Coxsackie virus, the most commonly known A16, which is part of a group of viruses called enteroviruses. This can spread through saliva, fluid from blisters, feces, respiratory droplets, direct contact with unwashed hands or infected surfaces. Who is at risk? Well, definitely young children, and this risk can actually increase if they attend school, for example, as viruses can spread more quickly when there is a dense population. Children usually build up immunity to the disease after being exposed to the virus that caused it. This is why the condition rarely affects people over the age of 10 years old. However, it's still possible for older children and adults to get the infection, especially if they have experienced some weakened immune system. How is it diagnosed? Well, usually by performing a physical exam, checking mouth and body for the appearance of blisters and rashes, and the physician may take a throat swab or stool sample that can be tested for the virus. This way he will confirm the diagnosis. How can we treat it? Well, in most cases the infection will go away in about 7-10 days. However, your doctor may recommend certain treatments to help ease the symptoms until the disease has run its course, such as prescription over the counter. It's like topical ointment, pain medication such as acetaminophen or ibuprofen, medicated syrups or pills to ease painful sore throat. In addition, you can also try to suck on popsicles or ice, eat some ice creams, drink cold beverages, or avoid citrus fruit drink, and soda. Of course, these are definitely food that can worsen the situation. Avoid spicy or salty foods, or actually you can swish warm salt water around the mouth. This can help release the pain. How can this be prevented? Well, practicing good hygiene is the best way against hand, foot, and mouth disease. Regularly washing your hands will help a lot and reduce the risk of contracting the virus. It's also important to disinfect any common areas in your home on a regular basis. Now, try to get in the habit of cleaning shared surfaces first with soap and water, then with a diluted solution of bleach and water. You should also disinfect toys, pacifiers, and other objects that may be contaminated by the virus. In addition, if you experience any symptoms such as fever or sore throat, stay home from work. You should continue avoiding contact with other people also once the telltale blisters and rashes develop. This can help you avoid spreading the disease to other people. How long are we contagious for? Well, we are contagious for for sure the first week after the beginning of the illness, but we could remain contagious though it's of a lesser degree for a few weeks after the symptoms go away. I hope this video has helped you guys. If you have any questions, do not hesitate to email me at raf.pilla@gmail.com. Again, raf.pilla@gmail.com. Thank you for watching.